The hidden effects of stroke. What you need to know. A stroke happens when there is an interruption of blood flow to the brain that results in brain damage. But the effects of a stroke go far beyond what most people realize. A stroke can affect not just your physical abilities, but also your emotions, thinking, and behavior. In this video, we will discuss some of the hidden effects of a stroke so that you are more aware and know what to look out for. So make sure to watch until the end. Difficulty swallowing. Dysphagia is a condition that makes it difficult to swallow. It's a common problem after a stroke, affecting about 1 in 3 stroke survivors. Dysphagia can make it hard to eat, drink, and take medicine. This can lead to malnutrition and dehydration. It can also increase the risk of choking. People who have dysphagia may not be able to eat normally. They may need to use special equipment to help them swallow. Aphasia. Aphasia is a language disorder that can affect a person's ability to speak, understand speech, read, or write. It's common after a stroke, affecting about 1 in 4 survivors. Aphasia can make it hard to communicate with others. It can also make it hard to do things like shopping or reading a menu. Some people with aphasia can still communicate with others using gestures or pictures. Others may need to use special devices to help them communicate. Visual field loss. Visual field loss is a common problem after a stroke. It can make it hard to see objects or people in your peripheral vision. This can make it hard to drive, read, or perform other tasks that require good eyesight. People with visual field loss should avoid activities that require a lot of focus or attention, such as driving at night or reading in dim lighting. Memory problems. Memory problems are another common problem after a stroke. It can make it hard to remember new information or to keep track of time. This can make it hard to function independently. People with memory problems may need help from family or friends to keep track of appointments or medications. Emotional changes. Stroke survivors often experience emotional changes as well. These can include increased anxiety or depression, as well as changes in personality. For example, some survivors may become more irritable or agitated. Others may become more withdrawn and uncommunicative. Some survivors may even develop new phobias or obsessions. These emotional changes can make it hard to adjust to life after a stroke, but there are treatments available to help, such as therapy or medication. Urinary incontinence. Urinary incontinence is a problem with holding urine in the bladder. It's a common problem after a stroke, affecting about 1 in 2 survivors. Urinary incontinence can be embarrassing, and it can make it hard to function independently. People with urinary incontinence may need to use absorbent pads or catheters. They may also need to see a urologist for treatment. Pain. Pain is another common problem after a stroke. The type of pain varies from person to person, but some common types include headaches, neck pain, and back pain. Pain can be constant or it can come and go. It can be mild or severe. Pain can make it hard to sleep, concentrate, or function independently. There are a variety of treatments available to help manage pain, including medication, physical therapy, and acupuncture. Fatigue. Fatigue is a feeling of tiredness or exhaustion. It's a common problem after a stroke, affecting about 1 in 2 survivors. Fatigue can make it hard to get out of bed in the morning or to stay awake during the day. It can also make it hard to do everyday tasks. Fatigue is often worse in the first few weeks after a stroke, but it can last for months or even years. There are things you can do to help reduce fatigue, such as getting enough rest, eating healthy foods, and exercising regularly. Loss of balance and dizziness. Vertigo is a sensation of spinning or whirling. It can make you feel like you're losing balance or that the room is spinning around you. Vertigo is often accompanied by nausea and vomiting. It's a common problem after a stroke, affecting about 1 in 5 survivors. People with vertigo may need to use a cane or walker to help them balance. They should also avoid driving or operating machinery. Other physical problems. In addition to the problems already mentioned, strokes can also cause other physical problems. These include paralysis or weakness on one side of the body, difficulty walking, tremors, and seizures. Paralysis or weakness occurs when there is damage to the part of the brain that controls movement. This can make it hard to move the arms, legs, or other parts of the body. Difficulty walking is a common problem after a stroke. It can make it hard to walk without assistance. Tremors are involuntary shaking movements. They can occur in any part of the body, but they are most common in the hands or arms. Seizures are sudden electrical disturbances in the brain. They can cause a variety of symptoms, including convulsions, jerky movements, and loss of consciousness. Cognitive impairment. In addition to the problems already mentioned, strokes can also cause cognitive impairments. This includes difficulties with attention, concentration, memory, and problem-solving. Cognitive impairments can make it hard to function independently. They can also make it hard to return to work or school. Behavioral changes. Strokes can also cause behavioral changes. This includes problems with impulse control, judgment, and social skills. Behavioral changes can make it hard to interact with others. They can also make it hard to follow rules or make good decisions. How to help someone who has had a stroke. If you know someone who has had a stroke, there are several things you can do to help them. First, be patient. It may take some time for them to adjust to their new situation. Be understanding. They may be feeling a lot of different emotions, including anger, frustration, and sadness. Be supportive. Offer to help with things like grocery shopping or cooking meals. And don't be afraid to ask questions. If you're not sure how to help, just ask. Conclusion. As you can see, the effects of a stroke can be devastating. But with the right support and services, stroke survivors can make a full recovery. Do you know anyone who has experienced stroke? If so, please share your thoughts in the comments below. We would love to hear from you. And if you found this video helpful, please let us know by giving us a thumbs up. Thank you for watching. Until next time.